Hi, and welcome to a new series of health-related travel videos. In this series, we will be discussing various medical topics that in one way or another have to do with traveling and hopefully will help you deal with situations that you may encounter while on your vacation. In this travel and health video, you will learn a very simple way to do a quick assessment of your ankle that will give you an idea of how severe is your injury and what are the next steps that you should take. Ankle sprains are one of the most frequent musculoskeletal injuries that I see in our emergency room right next to back pain. Not that there is ever a good time to sprain your ankle, but when you are on vacation and traveling abroad, this might be probably the most inconvenient time. I created this video mainly for those of you who are or will be traveling and may not have easy access to a hospital or a clinic. Hopefully this video will help you make a better decision about whether you should go through the struggle and possibly large expenses for a hospital visit to get your ankle x-rayed, or if you can just follow simple steps to start rehabilitating your ankle. While most of the time ankle sprains are just that, simple sprains, there is always a possibility for a fracture or broken bone in your ankle, and that is what usually brings people to the emergency room. They are simply concerned about a possible fracture. While x-rays are very helpful in telling whether you broke a bone in your ankle, if you ask any radiologist, they will probably tell you that many people are getting x-rays that they don't necessarily need. The reason for that is that in most cases you can do a quick assessment that will give you a pretty good idea about the severity of your injury and give you a hint if an x-ray is something you should probably consider. So let's start. To help healthcare professionals decide whether a patient needs an X-ray, a simple assessment tool was created. This assessment tool is called Arava Ankle Rule. Keep in mind that based on studies, it has been established that the tool is great in telling us when there is no ankle fracture, but it is not very accurate to tell us if we actually do have a fracture. Meaning, just because you find some tenderness over the bony landmarks doesn't mean that you have a fracture in your ankle. It only means that you should look to see if there is a fracture by getting an X-ray. So how do we use the Arava ankle rules? When using this tool, pressure is applied on several bony areas around your ankle, and in combination with your ability to walk on the ankle, a pretty good judgment can be made as to the need for the X-ray to look for a broken bone in your ankle. To use the assessment tool correctly, you need to be familiar with the names of few bones around your ankle. Tip of the lateral malleoli, which is the ankle bone at the outer part of your foot. Tip of the medial malleoli, which is the ankle bone at the inner part of your foot. The base of your fifth toe, and a bone called navicular bone. You do not need to remember the names of the bones as long as you know where to put your fingers. While we could get into more details on how to use the Arava ankle rule, for simplicity of our assessment in the field, we will narrow it down to two basic points. Point number 1. Can you put weight on your ankle? If you cannot put any weight on your ankle, stop here. Since you are not a healthcare professional and you cannot do a more detailed assessment, start looking for a clinic or a hospital where you can see a qualified healthcare provider who will do a more detailed assessment and may order an X-ray. Point number 2. If you can walk on your injured ankle, press on the following bony areas: the tip of the medial malleoli, as well as an area about 2 inches above this point. Tip of the lateral malleoli, as well as an area about 2 inches above this point. The base of your fifth toe. Palpate for tenderness over the navicular bone. If you have pain when pressing on any of the bony areas, that is enough information to tell you that you should look for a healthcare provider to do a more detailed assessment and decide if an X-ray is necessary. If you can walk on your injured ankle and you do not have tenderness on any of the 4 bony areas we just mentioned, based on the studies evaluating the out of an ankle rule, there is about 95% chance that you did not break a bone in your ankle. Once again, this is only a guide, and if you are still concerned about a possible fracture, you should definitely seek a medical care. The goal of this video was to help you better understand your injury and whether you should be concerned about an ankle fracture during your travel when getting to see a healthcare provider may not be the easiest task. In my next video, we will look at things you can do right away when you sprain your ankle to give you the best chance for successful rehabilitation. Hope you enjoyed this video. Please like and subscribe, and we will see you in our next video.